This is Stefan Schmidt for InsiderIowa.com. We're here at Iowa State University. This is the Bernier Art Museum, and the painting behind us is a painting of Ding Darling done by Orr C. Fisher. Ding Darling is a famous Iowan conservationist and actually nationally and internationally recognized wonderful person. We're here today to just briefly sum up what's happened with healthcare reform. And where we are today is that President Obama yesterday signed the House healthcare reform bill, and it is now the law of the United States because he signed it. In order for it to actually be activated and for healthcare reform to begin, the Senate now has to pass a version of the bill that is identical to the one that the president signed. The Republicans are very upset and are now going to try and change anything they can in that Senate bill, even if it's just a comma or if it's $1 in the budget, because any changes that occur would then stop the process and require both House and Senate to start all over again and fix and reconcile the bill. But if the Senate hangs tough and if the Democrats simply resist and pass the bill that they have in front of them with nothing changed, then health care reform becomes the law and is activated. What's interesting is that the Republicans have decided apparently that they are going to fight even though they're basically beating what we call a dead horse. The idea is once a horse is dead, you can beat it, but it's not going to get up and walk again and be useful. I believe that healthcare reform is now on the books. Americans are very relieved that this debate is over. Even if they don't understand the bill and what's going to happen completely, they apparently are exhausted from more than a year of debate, discussion, and some very tough politics. Already the public opinion polls overnight actually jumped for support, or at least for saying that they're happy that the health care reform legislation has been passed, and that's a change. Right before the vote and before President Obama signed it, the numbers were much less favorable. I think it may be a bad strategy, as I've said in the column in Insider Iowa, for the Republicans to stand with resistance to health care reform much longer, because people would like other issues now to be discussed and addressed in Washington. I think it is going to backfire for them now to claim that this is an unconstitutional bill, and for them to keep stirring the waters and stirring the scum on health care reform. I honestly think that people now would like to see other critical issues addressed. Immigration is one of them. That's on the books. Job creation. The economy is still very fragile. The numbers this morning on housing starts are terrible, and there needs to be some major action to try and reactivate the construction industry and get private business back on their feet, get lending out to small companies and Main Street so that companies can expand. So it's been a very interesting ride. I expect healthcare reform to start rolling, and a few of those policies will actually come into effect very quickly. Some others don't really kick in until 2015, so that's quite a ways off. But it'll be interesting to see whether the Republicans continue to try and use healthcare reform as their way of unifying their party and of driving public opinion against the Democrats. If they do, I'm thinking that it probably will backfire. I think they should concentrate on some positive solutions, talk about other issues that are of interest. So this is Stefan Schmidt for InsiderIowa.com at the Bernier Art Museum. I call it an art gallery on the campus of Iowa State University.